Hello and welcome to another video of USMLEowesome. This video is on the Step 2 CS exam. The intended audience of this video are those who do not have any idea about the Step 2 CS exam and are just starting. If you are already studying for the exam, the subcomponents part of the video might be helpful to you. I would recommend that you watch that. What will this video cover? When should I give the exam content and format, scoring and subcomponents, and how to prepare for the exam. So when should you give this exam? This exam can only be given in the US. After electives or observerships is a good time because you are used to seeing patients in your day-to-day interactions, and that's why it's a great time to give the exam. Or anytime you're going to the US after your core rotations, which means you are able to take history, perform a physical examination only after your core rotations. I wouldn't recommend taking this exam early in first year or second year of medical school. Exam content. The Step 2 CS exam is a standardized patient exam, which means you're supposed to walk into a room where a standardized patient, aka an actor, will act like a patient, and you have to elicit history and do a physical examination and develop an effective physician-patient relationship. And after the patient encounter, you're supposed to come outside the room and write a patient note. The exam format consists of 12 patient encounters of 15 minutes each and a 10-minute patient note typing time. The exam lasts for approximately 8 hours. And you have 50 minutes of breakdown where you can have light lunch. You can read up more about the exam format in the link given. So how is the Step 2 CS exam scored? Remember, the USMLE Step 2 CS is a pass or fail exam, which means there is no score. You either pass or you fail the exam. Do not fail the exam. There are a lot of things that can go wrong, and there are a lot of factors which are uncertain about the match. You do not want Step 2 CS failure to be a part of your application. It's a big red flag. It makes things really difficult. Do not give the exam if you're not prepared for it. Do not risk failing this exam. Delay your tickets if you have to. Practice, but do not give the exam and fail the exam. The Step 2 CS examinees are scored on 3 components: communication and interpersonal skills, which basically assesses whether you can talk to the patient. You should be able to develop a patient-physician relationship. You should listen attentively. You should show care, concern, and respect towards the patient. You should have the information gathering skills. What I mean by that is, are you able to ask open-ended questions so that the patient can give you the appropriate information, or are you leading them on with your questions? Are you asking them yes or no questions? You should be able to provide information in terms the patient can understand, which means if you're using too much medical lingo, you will be scored lower on your CIS. Patients cannot understand myocardial infarction. They have to be told about having a heart attack. And the examinee should demonstrate ability to support emotions, which means if the patient starts crying or if they're really angry, you're supposed to acknowledge their emotions. If they're really scared, and I will talk about that in the next video where I detail about how to interact with patients. But remember, you should be able to gather information from the patient, support their emotions, make sure they understand what you're saying, and show concern, respect, and genuineness in your interaction. They don't want a robot treating them. The spoken English proficiency tests whether you can talk English. It scores you on your clarity of English, for your pronunciations and word choice. And you have to be very loud and clear. Your patient cannot say, "What? I can't hear you. Can you please repeat? I cannot understand you, again and again. Minimizing the need to repeat questions or statements. So, personally, in my exam, once my patient said what, and I got so scared. I was so loud, clear, and slow for that patient, so that I made sure that he understood what I was gonna say, what I was trying to say, without the need to repeat any statement. This is very important. Now, do you have to be very fluent in English to pass the SEP? And the answer is no. For the Step 2 CS exam, you just have a generic set of questions and responses that you are supposed to ask. So if you're very thorough with these, even if you're not very fluent in English, you can still pass the exam because you've practiced the questions and the responses that can be given to the patient. So, spoken English proficiency, do not be disheartened by it. You can pass the exam even though you're not fluent. But if you talk too fast or if you're not clear, you might even fail the exam even though you're good at English. So remember, you have to be clear. The patient should understand you. Integrated clinical encounter. Can you, doctor? This means basically that did you get enough information from the patient encounter to come to a diagnosis? How will you be assessed? You'll be assessed on your data gathering and data interpretation skills. By the physical exam portion of the encounter, this the standardized patient or the SP will do for you. The patient note raters, basically what you write in your patient note is going to be rated, and global ratings provided by trained physician raters. I have no idea what that means. So, for your patient note expectations, you'll be expected to write correct medical terminology, which means you can't say, I have a pulled muscle or something, like the patient has a pulled muscle. You have to say that he has a sprain. You can't use things like heart attack or tummy ache. You have to use specific terms like myocardial infarction or peptic ulcer disease. Providing detailed documentation of pertinent history and physical findings, which means you can't just say throat is clear. You have to write that the throat has exudates, etc., etc. Obviously, these won't be there in your obviously exudate will not be there on a standardized patient because most patients are normal. So maybe if they have like a bruise and their hand is painted red or something, you can document these physical examination findings. Listing the correct diagnosis in the order of in the order of high likelihood. If MI is very high on the priority, write it as the first diagnosis, not the last diagnosis. And having supporting diagnosis and pertinent findings obtained from history and physical examination. How to prepare for this exam? Practice, practice, practice. Practice taking the history with a standardized patient. Practice physical examination. Practice typing the note. The only way to pass this exam is to practice. The resources you'll need is somebody who can act like a standardized patient. The study partners can be your friends, medical friends, preferred, or people who have no idea about medicine. You can find study partners on social media websites such as Facebook, on Skype, on forums. Just post a question on the appropriate group asking who is giving the exam when. And if your timelines match and if your study techniques match, you can maybe practice cases together. You'll also need the first aid for the Step 2 CS exam. The book is very comprehensive. You will need to practice most of the cases given in first aid. I would recommend doing first aid at least twice before the exam. I was very paranoid about this exam. I may have done it like twice, but at least once you have to do it, and twice if you want to be sure. Time management is key. So if you're taking too much time to get the history and if you miss out on the physical examination and the closure part of the examination, you might get into trouble. So practice with time constraints. Optionals are professional courses provided by companies. I have not taken any courses, so I cannot recommend which you can or cannot do. These are quite expensive and they're optional. Lastly, I wanted to tell you about irregular behavior. Read about it before giving any exam. You cannot discuss cases with fellow examinees. You cannot talk or communicate in any other language besides English. And you cannot reproduce these materials by any means. You cannot pass them on to friends. You cannot post them on the internet. Please read about the irregular behavior. Please do not indulge in any kind of behavior that is considered irregular. Hope this general overview about the Step 2 CS exam was helpful. I will make a detailed video on how to interact with the patients during the Step 2 CS exam. It's hopefully going to be my next video. So stay tuned, like, subscribe, and stay awesome.